Okay, so we know how to fold towels, right? How to do that. And the way that we're going to get this ready for draping, you open them up and you put about a 2-inch little cuff there. And I lay one out, lay out another, and lay it on top. And I do 3 this way. And then I take my 4th one and I fold it away from me. So the first 3 went like this. The last one goes this way. Make sure you're not allowing these to drag on the side of the table and then pull them up. So they're staying flat on the table. And then I'm going to make an airplane, which means I'm going to fold it like this. And then I'm going to fold it like that. So that's ready for my doctor when he comes in and he's ready. And you'll see this again and again. So that's how that goes. And what I'm doing over here right now is stacking things in the order from what I need first all the way down to what I need last. So I'm going to gown and glove my surgeon. That's the first thing that's going to happen. First thing, I'm going to hand him a towel. Then I'm going to hand him a gown. And then his gloves. And then I'm going to hand him towels. And then we're going to drape. So that's exactly how that goes there. All good and ready, and I just keep on coming over and getting the next thing up. And then another good thing to do before I go too far is to increase your sterile field. So that. And now when I start to, organize my stuff, anything that I know I'm getting ready to take to the field, I'll just go ahead and be putting it here on the mayo. I'm going to get here and pull that down on top. If it's not super high, don't take the time to do that. Okay, so I need to lay a towel down. I want to reinforce this table cover like you did at some point, right? And you really don't want to lay your towels on your stuff. It's not a good idea. So there's that, and then we'll just do one towel. No, I need. This is going up to the field with me. And Bodie is my light handle covers and my scratch. Oh gosh. That's all going to the field. So I'm going to kind of set up again the area that I'm going to work on, knowing what I'm going to be needing. This kind of goes with my sharps. That's another sharp and my blade. A septo there. It goes on the edge of the table because the person who's pouring something in it is not sterile. So I don't want her leaning over my sterile field, so I'll put it right there on the edge.
Aaron.
Sorry, didn't mean to.
Oh, no problem.
All is well.
So then with my towel, and this is just for whatever I need. I really don't need this. It was the paper towel that came for the doctor's gown, but you never know when you need it. When I'm using really fine sutures for like eye surgery or something like that, if I lay it on that white paper towel, I can actually see it. We lay one towel down to reinforce where our instruments are going to be laying, and then I make my roll. So every bit of this, every step needs a little practice. Here's how you make a roll. I'm going to take this towel, I'm going to roll it up. If you roll it up this way, make a little burrito. If we roll it up this way, it's still too flat and flabby, and it won't hold your instruments up. Just so you know, you're getting ready to enter a zone of a new enemy, and that's called your stringed instruments. They will try to get away from you and sabotage everything you're trying to do. So we've got to keep them ruly and keep them under control. So here, instead of rolling this way, I roll this way. It's longer and it makes it thicker and bulkier. You make almost like a little mini airplane here, but not too much. We don't make a point like this. If you do and you roll it all up, the middle part has a big old bump in it, and then all your instruments fall off to the right and to the left. So just a little bit, and then I'm going to go ahead and roll up. And this should not take but a second. Just so you know, when you're trying to trim your time down, you will find that for whatever reason, when you start doing the towels, you just go into like a daze. I think it's because you think for a couple minutes, you actually can kind of relax. You don't have to think about anything. So this is like the slowest part of it many times, especially this towel roll. It always is over. So there's that. Now I'm ready to come get my instruments. What? What? Oh, a roll. So I'm going to put a roll also on my instruments. Again, I'm just going to do this. A roll on my mayo. And there goes that. That's going to be for the instruments I'm taking up to the field. These are the ones I'm not going to be using quite as much. I have 2 extra towels. I never know when I might use them. No, the only thing that you may notice is the blue ones are a little bit smaller, and there are different sizes in the hospital, and there's different thicknesses. So you'll just kind of learn what you like best for, say, your towel roll. Like, you know, I don't want to use a green towel for my roll, or I don't want to use a blue. That'll all be your preference. I'm ready to come get my instruments now. I've got to stay 12 to 18 inches away from the outside of this container, and then come in and get this. These handles, I'll reach in and pull them over here. Now I'm ready to go
doing it for
through
like a long time.
like we did the other day. And you'll see this when we go into the lab, but what I'm doing, I'll pull this around. I am laying these rings, they're wedged between my towel and the tray. These I don't need, they're only for keeping the instruments together while they're being stored. So you can just kind of throw those off wherever. So now I'm just spending a few minutes doing some sorting here. Medicine cup, pickups, or maybe you can put these anywhere you want, as long as it's just you know, organized and you know what you're doing. Everybody's going to do this part differently.
What she's doing with pickups, guys, is sorting by teeth or no teeth. So you can kind of know which one's on which side, just grab. Smart thing.
Yeah. And my towel clips, I put them over here with this so I don't forget to give them to the doctor. So I just kind of always know that. I guess I can leave the table here like this for a moment. And then I'm ready to count. Pretty much. Oh. Okay, don't look. Alright. And if I have any trash or anything like that, usually there's a trash can I might be able to get to rather quickly. Yes.
Sorry. As far as laying the retractors along the tray on the outside,
Mhm.
I see some you actually have laying out onto the reinforcement of where you laid your towel, and then the others are they're kind of laid along the edge, but they're kept inside the tray. Is that basically, because I understand the whole area is our sterile field, but is that just based on space or based on anyone coming around and
Yeah, it's
possibly
not good
contaminating
practice to
those
say
things?
like have them like this. You see what I'm saying? You wouldn't want to have them hanging out over the table or anything like that.
Good with that one.
Yeah.
It's okay.
It's still scary if I have a circulator that's not real careful.
Mhm.
I probably they're not hanging over.
Keep
Or if
them
you're doing
basic.
something small, I just leave them laying on the tray. I mean,
Yeah.
it just depends on what you're doing.
Just
None of
keep
this
them-
is all preference.
Okay, just keeping them basically where you can be in immediate, like,
Yes.
control of seeing them.
Exactly. All I need to do is to be able to put my hands on it if he says, you know, whatever, Army name. Then I are able to put my hands on it.
Setup is a very personal thing because that exactly your job is putting your hands on it. So you set it up so you know where it is and you can find it. And you'll find that when you get to the hospital, somebody else set it up, you can't find anything because you don't know where they put it, kind of thing. So don't get so caught up in having to do everything the same way as everybody else. As long as it's within your parameters, you're good.
And that's what I was telling you. I actually will have you draw your mayo stand in your back table. Once you've done this a few times and we kind of give you some guidance about, you know, what makes sense or not, then I'm going to have you draw exactly what you're doing to see if you've got the right stuff on your mayo stand and, you know, that nothing around here. You know, if you've got, I'm going to keep my basin here, then I'm going to say that's not really a good idea because you need the nurse, yeah. So, you know, things like that. But as long as, you know, it works with aseptic technique and the best, you know, like I said, there's no need in you having to reinvent the wheel. There's some things that are just easier if we just kind of tell you. But you can, you know, pretty much do, I mean, one thing that is kind of a weird thing for me is if some people put their blade is like pointing down towards the palm of their hand, where I have my blades always, you know, sticking straight up on the towel. Which, by the way, I'll go ahead and put a little safe zone here. Now, we said my patient's going to be right here, so I put everything I need on my side of the mayo stand, and everything the doctor might could use on the other side. And what that means is all this stuff before we even get started with surgery, we got to hook up the Bovie. We got to hook up suction. This is part of the Bovie. And we also need light handles. So all this is going to be gone before we ever start our surgery. If you put it over there where the doctor can reach it, then a lot of times when you pull it to the field, the first thing they do is start picking those things up and setting them up. Because they're not like, well, that's not my job. They're like, we need to get this surgery done. So they'll take care of this. So if they can reach it, then they will a lot of times, and so that'll all be gone, and then I'll have more room here in a minute. I also need to load a blade, but that'll come a little bit later. So, what was I gonna say? Am I ready to count? All right. So now I'm ready to count. I'm gonna listen to Aaron, and I told you I usually use my knife handle when I do my instruments. All right, so where am I counting first?
Sauce.
The rate tag. Yes. So I have 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And laps, I have 1, 2, 3, 4, and 5. Sharps, I have 1 suture, 1 hypo, and 1 blade. And she could probably see that from where she is, but, all right, and then, whoa. Okay, and then I'm ready to count instruments. Oh, I did? Where? Oh, my Bovie. Okay. What salt did I use?
Or scratch.
Okay. I have 1. So, and then 1 Bovie and 1 scratch. And that is the hazard of putting stuff on your mayo first, is you might tend to forget. But it also, like I said, it saves time once you get used to it.
William,
Yes.
when you are setting up your mayo stand, it would be in a different position than where you
Well,
are
what
now,
it would
right?
be is this is my patient right here. I would have, say the patient's head's right here. I would pull this over here, and my back table, and I will show you this more in the lab, but
Okay, because I was wondering, because you had your
no.
back to.
I just had it turned
so-
that
okay.
way so that you could see.
Okay.
But this is how it goes. mayo stand, and then back table. These corners are touching. Yeah.
I'm glad she asked that, because that was actually a question that I had, like, when we're in the lab, like, where we have the back tables currently positioned, like, up against the walls, we're never actually gonna have that situation, because once we're at the patient, that means our back is to the back table, correct? So our back table is actually gonna be, like, at the foot
Pull
of
it up.
the patient.
Yeah,
At
we
the end
bring
of
it
the-
up
like-
when we
Like
come.
an L shape at the.
Yes, it's
foot
gonna
of the
be this
patient.
L shape. Like I said, my patient's head is right here. My surgeon's standing over there. Patient's legs are right here. And so the first thing I'm gonna do after I drape is push my mayo up, and hopefully that doc is gonna keep himself busy right here while I go get my back table and, you know, do whatever else I need to do. So, or, you know, set up over here or whatever. So, shall we continue with the count? Oh, even though this is considered a soft, they're generally together and they're counted together. So it's counted with the sharps. But you'll figure that out. You're gonna come over here and go, and I have one bogey tip and one scratch pad. Okay, and there's all kinds of other miscellaneous items that actually are countable. They may not be in your checkoff, but there's a few more things. Will you look in that drawer over there? I think I left a couple of other weird things that might be counted. Yeah. This is for laparoscopic surgery.
Fred, I know Fred.
Oh, good.
Yep, Fred.
Yes. So Fred, the bottle, and the sponge are counted. So that would be 2 items. They're not sharp, softs, or instruments. It's just other countable items. These things right here are called suture boots. Let me get those. We'll just count those with the sharps. They're small. I mean, not sharps, but soft. See how if I'm going to come in here, I keep my arm up and keep my fingers away from the edge. And this is used a lot of times in vascular surgery, especially with really fine sutures. It may slip between here or even cause the suture to crimp a little bit if we squeeze it in a hemostat. So we can put some boots on it. Like this. And now it's soft and rubber and plastic. And all these are countable items as well. Suture boots.
Learn that in Greek,
Oh, okay.
So, yeah. So anyway, when I'm counting these, you know, I probably would have them still in here, but I can say I have, you know, 2, 4, 6, 8, 10. And she would put that on her